So for our next presentation, we have tips and strategies for talking to your children about genetics. Rebecca McClellan from Kennedy Krieger Institute. And again, you can read all about her wonderful achievements in the biographies. I'm going to give you some other interesting tidbits. Rebecca loves to travel. Most recently, she's been to Peru, enjoyed a Machu Picchu scenery with her family. And I hear you're quite a foodie.
Yeah.
You like different experiences with food and try to different foods. So,
thank you.
With that, I will let you go on.
Great, thank you, Ned. When we started to talk about what we wanted to bring to sort of the genetics and carrier programming track for the meeting, this was something that had come up. So initially in the past, we've done it's been a couple years, but we've done a slightly similar talk in the context of talking specifically about carrier testing and sort of talking to your daughters about when it's time to make that decision for carrier testing. But really when you think about the cognitive processes that go into making decisions, it's equally, I think, relevant to both boys with Barth syndrome as well as your daughters with making key decisions about carrier. So, there's a lot of talk and focus this meeting on transitions and getting your boys sort of ready for being more active in their healthcare, and we thought that this sort of fell nicely into that as well. So I'm going to start just with a very sort of brief review, a little bit about cognitive development and things like that, and then I have 3 lovely assistants who are going to come up and we're going to do some role plays. And we're going to go through some different pretty challenging scenarios, and they're meant to be challenging. Again, these are all sort of fabricated from sort of collective years of experience. Don't try to figure out from my ages or anything. They really don't have any specific family in mind, but really they're picked to kind of set up a situation or a scenario that could be plausible based on what we're trying to get you guys to talk about. And just, again, no right or wrong way to talk to your kids about any of this stuff, but I'm going to just share some sort of suggestions or guidance as we go through. So the first and most important thing for you when you are talking to your kids about genetics is that you understand the genetics first, all right? So I know you have all been here for many meetings, but that is the very first thing, right? So being able to make sure they know what a cell is, that they know that DNA is the recipe or the blueprint that makes us all who we are, that genes are basically groups of those DNA letters, and they functionally carry out very specific jobs in the body, and if there's a change in a gene that has specifically the TAS gene, it may impact the function of the TAS protein, the cardiolipin, and not be able to do the job it needs to do. As Iris nicely set up, it's like we planned this, that not all changes in every gene always cause disease, and that's important to know. But sort of just being able to walk through this with them. They're going to get it in school, but you as your parents, it's helpful for you to be able to make sure that they have a good understanding of the information. The other thing specifically is being able to understand and help back up and explain the inheritance. I meet with them when they're here, but it's every 2 years. I'm not there in between, and they may go home and think they have it straight, but don't, or may hear something in school and then they're sort of have it mixed around again. So making sure that you have an understanding of the inheritance pattern in Barth, I think, is important as well. I'm happy to send this to anybody if they want copies for themselves. I see Sheila taking pictures. But basically, this little diagram, I've always thought it was a good one. And then we have one specifically for our guys who have Barth syndrome as well. But it's basically showing you that Barth syndrome is on the X chromosome, and that differs between males and females. And the little X with the R is the one with the change on it. She is presumably marrying a non-carrier father or not a boy with Barth syndrome. If we have a carrier that marries a boy with Barth syndrome or is having children with a boy with Barth syndrome, come talk to me because this all changes, okay? All changes. I've said this to the kids many times over the years, that if you're going to date within the group, come talk to me because all bets are off of what I say here. But basically with every time they go to pass on their eggs or their sperms, it's a 50-50 chance which X the mother will pass, and the father 50-50 chance if he'll pass the X or the Y, and this shows the sort of outcome combinations down here. And likewise, kind of similar setup again, and I'm going really quickly because you all probably have heard this a million times, but in this situation, again, you see the X up here in the gentleman, and he has the Barth change up here on his X. and the partner, again, non-carrier in this situation, but basically 50-50 chance with each, and the bottom shows you the outcomes that would occur. So for boys, as many of you know, is that all boys, when they go to have their children, their daughters will all be carriers automatically, no chance. It's 100% of their daughters will be carriers because he only has that one X to pass. But all of his boys will get his Y, and so the Barth syndrome will not pass down to his children, to his sons at all. So the next, really the kind of meat of what I want to talk about here is a little bit about cognitive development as sort of a framework to understand where your children are in their learning. And the biggest sort of, I think, longest standing theory of cognitive development, and admitting that there are many theories and many disputes and everybody doesn't always agree, but Piaget's theory has really stood the test of time and is really one that I think many of us have continued. If you've ever studied psychology or been in child development, this is something you may have heard before, but I think it's a really good framework for trying to understand where your kids are from a developmental standpoint and where they are sort of cognitively in that development. So when children are first born, they're in the sensory motor stage, and it's basically birth to about 2 years old. And in that stage, intelligence is really demonstrated through motor activity without the use of symbols. So little kids, they don't talk yet. They can't really use signs. They're not really understanding symbols. So it's really just about exploring their environment, finding their toes, things like that. So it's that's considered the sensory motor stage. They start to develop sort of object permanence, which is kind of an early form of memory by about 7 months old, but it's not memory as we think of it as adults, but it's being able to kind of know that, well, if I reach down here, I'm going to find my foot. You know, it's sort of that sort of level of memory. But then once they kind of get past 2, they start to, in toddlerhood, to move into this pre-operational stage. And that's when they start, and from toddlerhood through early childhood is really when you're starting to use symbols and language. You're learning to talk, you're learning to learn your numbers, you're learning your letters, you know, you're learning to read. That's using symbols to communicate and understand. And this is where sort of true memory and imagination really start to develop. It's also where they develop sort of non-logical, non-reversible thinking, which means that they can kind of remember something and have it, and that they are going to have this sort of start of some abstract thinking concepts here. It's also a very egocentric stage of development, and it barely sort of all about you when you're at this age, and it's probably, for the parents in the room, you probably remember it well. It's very focused on themselves. They will start to make friends, but they still think of themselves kind of as first when they're at this age of development. And then when you kind of move into elementary age, through probably about early adolescence, and adolescence is typically defined by the World Health Organization as about 10 years old. So here we're talking about school age, kind of into your early years of school. You move into this concrete operational stage. And this is where really more logical and systematic manipulation of symbols related to things, and you get these sort of understanding of concrete objects. This is where your math skills start to develop. This is where some of your other cognitive processes really start to grow and expand. And at this point is when the children can really start to build on past experiences. So not only do they remember them, they can kind of incorporate them into their thought processes as they start to continue to grow and get older. Operational thinking then really develops as well, and this is where they can have thoughts and think about them and then change their mind. So at this point is when you can sort of start to have reversible thinking and mental actions, meaning you make a decision about something and then you kind of think it over and you can really change your mind. When they're younger, they're kind of make something and kind of stick with it, is really how it is when you're in earlier stages of development. And the last stage is this formal operational stage. And I actually have read some numbers that not everybody actually makes it all the way to this stage or all the way healthily, fully into this stage, but most of us do. And this is usually adolescence through adulthood is sort of when the rest of your cognitive development is coming along. And this is where you start to better understand abstract concepts. so that you can use symbols and language and things, but understand something that's not right here in front of you, that's more abstract. It also is interesting in this later stages when you really start to go back in the beginning to another sort of stage where it's very egocentrical, they say, at least the psychiatrists say that. So this is kind of just a broad sort of overview of some of the developmental stages that people go through in their younger years. And really the take home is that usually by 7-ish, children typically have their cognitive and language skills down, and this is when they start to sort of are able to start to maybe participate in some pretty basic decision making. It's not until a little bit further into adolescence, 10, 11, kind of around there, and this, again, completely overlaid by maturity of the child, social, situations, family stuff. There's definitely, it's not a bubble by any means, but this is in adolescence that they start to get more concepts of morality, cause and effect, understanding what's right, what's wrong, and getting a sense of connection to the future. Sort of that the things I do now are going to sort of connect me to where I'm going down the road. And I think that that's actually a really important developmental milestone when you're talking about genetics and how these genetics are going to impact you when you're an adult. Because when you're younger, you can't really even think that far. I mean, I was going to be a marine biologist, but did I really know what that was? Like, not really. And I told people that for years and years and years, because people asked you and you're supposed to give an answer, but do you really, you don't have as much of a true connection and understanding of what that means. It's also, again, I mentioned it, but social maturity is really important here as well. In adolescence, they're still very vulnerable to coercion by family, by peers, to stigmatization, gosh, it's Friday, and self-image. So things that their family, that their friends say, all it would take, they may have made a decision for themselves, but all it's going to take is one friend saying, maybe we should really do this instead. And kind of in those early adolescent stages and things, you're still really influential in that regard. So this is not by any means like a child development class, but just meant to be sort of a kind of a overview, I think, of sort of where they are at kind of rough points in their life. And I think the biggest thing is kind of when is a child ready? When are they competent? And that can mean when are they ready to start, taking their own medication and handling that? When are they ready to make a decision about carrier testing? When are they ready to kind of step solidly and comfortably into sort of the higher level of decisions and choices in their life? And I think the biggest things to think about are understanding their capacity for understanding what they're being asked to decide about. They have to be able to truly understand the details of what they're being asked. And there are different levels of decisions. Some things are just asking them to be responsible for medications. Other things are making choices about, do I want to do this treatment that might make me not feel good? But they might not get sort of the benefits of it. They may not be able to easily see all the sides of the question at that point. The other big thing is capacity for reasoning and deliberation, being able to process through the decision on their own and make a choice that's been weighed out, that they've really put some thought into the choice and how it might affect them. And the last is sort of the capacity to develop and sustain a set of moral values. So what's important to them, what matters to them, and having a series, a tiered system of what's most important to them that they can use to frame the decisions and choices that they make. So this is not published by any means. It probably never will be. This is from me to you guys, just from my experience, I would say, over the years of working with your group and thinking about this for a long period of time and having a lot of you ask me, trying to just put something down to give you some rough guidelines. And admittedly, it is very rough, right? Because every family is different. But I think that when they are young, in that concrete operational stage, which we talked about, is really sort of early and elementary all the way through early adolescence. So this is your, 7, 8, 9, 10, start, they can start, and more closer to that the 9, 10 range, I think, start introducing the idea of Barth syndrome being genetic. just that it's something that's out there and that it's in the family, that it runs in families. They aren't going to have really even know what a cell is yet. So you're going to have to probably use runs in families or passes in families, right? Because they aren't going to have had any biology. They're not going to know what genetics is, right? They're not going to know that word. They're not even going to know a gene. They're really probably not have ever heard of DNA. But they will know Barth because they will have been a part of this group and have grown up here. And the one thing I've learned over the years is that you should always err on the side of talking to your kids sooner than you think it's time. Because they know, they've already been drug around to doctor's appointments, to meetings, they know something is going on, right? And so the more you wait and don't tell them, the more they sit there and they're like, why is nobody telling me anything? And so I think that just having worked with you guys for a long time, I feel like that's an important thing for you guys to hear, is that they know that there's something going on, and the longer they're in the dark, the more frustrating I think it can be. So I would say early, sort of that adolescent stage, start to introduce the idea that there's something here that can pass in families. As they get a little older, preteen, this is sort of here at the meetings when I start meeting with the girls about carrier issues is about 10 years old. The 10 years old is still a little young. Some of the girls I met with this time, I was giving a genetics lesson. They weren't really sure what cells were, or like genes were, and so that we did a lot of that. But the talk starts there. But then as they get a little older is where you start to discuss the idea of what it means to be a carrier. Again, always emphasizing that carrier does not mean you're going to have any health problems. That's a really tricky thing. When you're starting to try to tell them that there's maybe a change in their DNA or in one of their genes, however you just decide to word it, you want to make sure that they don't think there's going to be something wrong with them, that they're going to end up getting a heart problem like their brother or something like that. So you want to be reassuring as you go. And then also the option, sort of as they grow into that stage, starting to talk with them about the option of being tested. And I try to emphasize that word option. I think even though I meet with everybody and we talk about it kind of like it will happen at some point, it doesn't have to happen. Not everybody has to make the choice to get carrier tested if they don't want to. And some of the girls may wait a very long time. They just may not be ready. Some of the girls may choose to never want to know, and that is their option and their choice. And that's one of the reasons that we wait until they can make that choice and that we don't test them when they're little, because that's your choice as their parents. So it has to be their choice. For the guys at that point, that's when you want to start to discuss with them that their daughters could all be carriers. And what does that mean to them? May not mean anything to them. The carriers, right? We know we've got amazing carrier women in this group. And there's nothing wrong with being a carrier. But when you have sort of the technology that we have these days, you want to make sure they have the information and the knowledge to choose whatever they would want to choose. And then when you feel that they are to the point where they are competent and they are ready, that's when you sort of talk with the girls about, are they ready to consider carrier testing? And then once they've gone through that, making sure they have the knowledge of the different testing options and information, any information they want to have. For the guys, make sure that they are also aware of reproductive testing options if it's something that they want to utilize, and that they don't have misconceptions about how you can make sure you only have a boy and things like that, because there's a lot of wise tales. If you look that up on the internet, there's crazy stuff that will come up. Don't do it at a work computer. So this is it is rough, but it's meant to try to give some guidance and some sort of milestones to kind of think through and a way to think about it. But the rest of what we want to do this time is I'm going to ask for some of my lovely assistants to come up. I have 3 friends who are going to help me, and we're going to do some role plays to try to talk and show you guys just examples of how to do some of these very difficult conversations. So I have Cynthia James, who is a genetic counselor that works with me at Johns Hopkins, and she's been helping me with the carrier research. And then we have Lee Kugelmann, who has graciously been a part of this group and I think is a budding interest in genetic counseling, and so we've been encouraging her to be with us as much as possible, and has a lot of experience as growing up as a potential and then a carrier within our community. And then we've asked Jack to come and be our token male, and he gets to play a couple roles. He gets to be both boyfriend and brother in these scenarios. So I'll show you sort of briefly the scenario, and then we're gonna let these guys just kind of have a conversation. And again, this is not practiced by any means, so please don't judge us. Yeah, we're not actors, we're not improv, although he might be, I don't know. So in our first scenario, we have a 14-year-old girl with a risk to be a Barth carrier and her mom. In this scenario, I did a couple edits. The girl would like to get genetic testing for Barth syndrome to find out her carrier status. Lee's going to work on explaining to her mother why she should be able to get it, even though she's only 14, and not wait until she's older. And Cindy, as her mom, is very concerned about her daughter sort of getting tested before she's that magic age of 18.
All right, and we're meeting for the first time, and in real life, I have a 12-year-old daughter, so this may be really authoritarian.
Hey, Mom. Remember how we talked about how I could maybe have a kid with Barth syndrome?
Mm-hmm, yeah.
When can we find out if that's like something that will really happen?
Oh, that's a good question. Let's check. There's maybe some rules, although I think I've heard probably from the age you are now on up, maybe it's allowed, although we'd have to double check. But we'd really have to think through that to see if that's a good choice for you and for our family. Can you tell me more of what you're thinking about that? Is that something you've been worried about, or?
I've been thinking about it a lot, and I've always been around at the Barth conferences, and I know about Barth syndrome, so like I think I'm ready to know.
So what does knowing mean to you, sweetie? What do you think? What would it tell you that's important to you right now?
I don't know. I feel like I'd understand what my life is going to look like and what sort of things I might have to think about later.
All right, now I'm going to pretend you're my daughter in real life. So, sweetie, from the time you've been a tiny little girl, I know you've always been really interested in babies and having a baby of your own. And I don't know you at all. And so I know you've talked to Miss Becky a lot over the years. Can you tell me, what do you understand about the carrier test? So if you had this blood test, or maybe it's a spit test, I'm not sure. If you had this test and it came back and said you were a carrier, do you know what that means?
So that means that my boys would have Barth syndrome and my girls would not?
I think that's close. We'd have to check with Miss Becky. I think it means maybe you could have a baby boy with Barth syndrome. But I also think, and this is what I'm concerned about, that maybe 14 isn't the right age. Maybe I'd like you to be a little bit older, because there's going to be a whole bunch of choices. If you are a carrier, a whole lot of choices. Doctors are going to start talking to you about do you want to have that chance? Do you not want to have that chance? I'm a little concerned. That stuff is really complicated, and it's really hard to think about, particularly for a girl like you that I know from the time you've been a tiny little girl has wanted to have babies. So I'm thinking maybe we should talk to Miss Becky. I'm a little concerned you're not quite there yet. It gets really complicated.
Okay, let's talk to her. I think she could help.
In this one, we switched the roles a little bit. So this is now a little bit older young lady, 18-year-old girl with a known risk, again, to be a Barth carrier, and her mom, because again, we don't want to drag a dad in the room. And in this case, the mom is going to talk to her daughter about getting genetic testing, carrier testing for Barth syndrome, and really wants her to have the test now because she thinks it's impacting her life. She thinks she's avoiding relationships because she's worried about this. And the daughter just is really feeling pressured and is really unsure and doesn't feel like she's ready.
Sure, I'll start. All right. So, sweetie, this is awkward, and this is something I know is going to be a difficult conversation for both of us, but there's something I'd really like to talk to you about, and I always figured right now driving in the car is always a good time for us to have these conversations. So last month we went to the Barth meeting again, and I know you talked with Becky and you talked with some of the other girls, and the issue of carrier testing came up, and I was just going to check in and see with you. Tell me where you are with that. Is that something you've given any more thought to, or tell me how you're thinking these days?
I mean, I don't know. I know it's maybe something I have to do, but like I just graduated high school, I'm going to college. I'm not really thinking about having babies right now.
And I totally get that, and as your mom, I don't want you to be thinking about having babies right now. But you're going to college, and as your mom, you know, college is a different time. This is going to embarrass both of us to have this conversation right now. But really, you know, it's likely to be the time you have your first boyfriend. You're going to be away from home. Yes, we will have a conversation about birth control, but I think for you, this information about whether or not you're a carrier could really help you make some good choices while you're away from home the first time.
Well, I don't know. It feels like it would be a lot of pressure if I found out right now. I just don't know that I'm ready yet.
I hear that, and I can understand that too, and especially if you're going to go away from home. I think it would be reasonable. Certainly I would never want to push you into having something you're not ready for, but I do want to feel confident that in the back of your head you know that an unplanned pregnancy for you might have higher consequences.
I mean, I get it. We've talked about the genetics talk, so I understand how it works, and it's something that I do think about sometimes. I just don't think I'm ready right now.
All right, that makes sense to me. I think we can go with that and wait for the future. All right, so.
Good.
Actually, before we go on to the next one, I was wondering if people could give us feedback, thoughts. Is this realistic? Like I say, I'm not in your shoes. I'm just a bossy mother of a 12-year-old, so.
I think it's good, especially, I have all boys, and my big thing, I have a 27-year-old and a 16-year-old. But if I had a daughter, I would want to talk to her about that. And my main thing with my boys is I constantly tell them, you know, you wouldn't go outside without a raincoat on when it's raining. Please, if you decide to be sexually active, don't go without a condom either, because it's just the same thing, because you're protecting yourself not from just pregnancy, but you're protecting yourself from any disease that she might have or anyone that she slept with, or protecting her from anything you might have. But then tell them, no, don't do it. And that's one thing, too. I think that we need to make sure that we discuss with them. I think you guys did a very good job of discussing, and I think we need to know, and it's awkward for the parent, and it's awkward for the child, whether it be the male or the female, when you talk to them, because you want them to know what the consequences could be if they have a normal pregnancy or a normal birth of a child, and more so when there's the possibility of Barth. I mean, both of my boys, Will is 16. He knows that if he has, if he gets a girl pregnant, the baby, if they're a boy, the disease stops there, and he knows that she'll be a carrier. And Ian knows that too. And Ian, at this point, at 27, has decided he wants to find a girl that already has children because he doesn't want to bring another Barth baby.
Anybody else? Any comments?
I think what's been really interesting about your talk for me is actually, even though we're mums of boys, we may have to have the talk with the boys' girlfriends.
Yes.
That's coming.
Yeah.
That's Jack.
That's a very valid point.
I think, and I have a 12-year-old who doesn't know yet if she's a carrier, and from what I hear from her is more, just Mom, I just want to know. Why can't I know? And why do other people get to make this decision for me that I don't get to know? I mean, it's my body and it's my information, and and we have gone over for a long time with her, the genetic piece of it, and that she knows she'll say to me, like, I know 25% chance, if I'm a carrier, 25% chance I'll have a boy with Barth, 25% that'll be a carrier, and she knows all the stats like that, and so she's kind of like, and I think what's harder is for me to try to kind of say, well, but you might feel differently when you're older, and she's like, no, I'm not going to, because she's 12, so she's kind of like, no, I just want to know, and it's almost a little bit hard to reason with her in a way, because and it is hard to say to somebody, there's a panel somewhere of medical doctors who've decided for you that you can't have this information because you're, quote, not old enough yet. And she feels very much like that's unfair.
And it is. It's a really difficult situation. It is. That's one of the reasons I tried to put some of the stages of development up there so that you can see why we, it's not 18, and that's the big thing. It's not this magic 18 that it was for years. It's not that. I will have happily and fully supported many girls who are younger go through carrier testing. But I think I would feel pretty strongly, unless it was a very mature girl, about waiting till at least 14, 15, and having some, and the younger girls especially, I would want to have some very, probably more in-depth conversations. I have in-depth conversations with the older girls too, but especially at that age, you just really, I think at that age, especially, she's 12, right? Yeah. So, really very unable to kind of really wrap your head around what it may actually mean for you. And it's more just about this mystery and the fact that she can't know than actually knowing what the information probably will mean for her. And that's where we just want to kind of get her to that stage, and then happily. I know it's hard, though. I can fully appreciate how difficult it would be. So.
Should we move on to the next one?
All right, so with this one, we're bringing up, first it's going to be Cindy and Jack, and then we have a part 2 with Jack and Lee. So in this situation, we have Jack, who's 18, and his mom, and then Lee is going to be his girlfriend. And so in this situation, your son has his first serious girlfriend, and you really want to make sure he truly understands the inheritance of Barth, and that you really feel strongly that he needs to talk to his girlfriend about it, okay? Jack, you've been going to the conference for years, but you haven't really paid attention to anything I've said. But now that you have a girlfriend, your parents kind of really won't get off your back, and you really don't want to talk to her, because you don't want to tell her this because it's a relatively new relationship, and you really kind of like her. So, and then we're going to switch around, and then we're going to have them try to have that conversation. So.
All right, Jack, so this is going to be even more embarrassing. In real life, I have a 10-year-old son, so now I'm going to be really bossy. All right, so, sweetie, now we're going to have to be in the car again. So I know...
Conferences in life, right? The car.
It's so true.
Get away.
Yes. So, sweetie, I know... and I've been so excited that you've been going out with Emily. And I was so thrilled to be able to meet her a couple weeks ago. And I'm really excited for you. And I can tell how much you like her. As your mom, and I know this is going to embarrass us, I need to have a conversation with you, partly about birth control. She's a serious girlfriend. So, we've talked about condoms from the time you've been 14. I'm not doing my job as a mom if I'm not checking in with you. Yes?
Thank you, Jack.
The other piece I want to talk about, so safe sex is important for you, just like it is for your sister. But in particular, I want to talk a little bit about, I know we've been going to Barth's conferences forever, but this is a serious girlfriend. A pregnancy for her may have somewhat different implications. I just want to double check. Can you tell me a little bit what you understand, what you do know, what you don't know? If she were to get pregnant, I know this is embarrassing both of us.
Well, Mom, it is my understanding that if I have girls, that they will be carriers, and if I have boys, that they will be healthy. Both will be healthy, both sexes, but the girls will definitely be carriers.
And is that something you're worried about, not so worried about, good with, not so good with? I don't know yet. It's so far in the future.
Well, I think I'm okay with it because of treatments today and all the, modern medicine. So if that were to happen, I wouldn't be totally distraught.
Oh, they've made huge amounts of progress, haven't they? I've been so impressed. So the other thing, and I know you guys were going out for a long time before I met her, and I know you're pretty serious. Is this a conversation you've had with her? Have you talked about Barth? Have you talked about really any aspects of Barth at all with her? Is that something you guys have talked about?
Not yet. I was kind of holding off as long as I could.
Yeah. Is there anything I can do as your mom to be helpful in that way, or any strategies we can talk about for broaching that subject? I'm happy to talk to her with you, but that might be too much. What do you think?
Well, I'd like to not have this conversation ever again, but I don't know. I guess maybe if you were there, she might understand more. Maybe not. I'm not sure. I think maybe it should be her and I at first, and then if she has questions, maybe she could ask you.
I'm good with that. I can be the resource in the background if you need me, but I am more than good with you guys having that conversation one-on-one.
All right, deal.
All right.
Okay. Emily, I want to talk to you about something. As you know, I have Barth, and I like you a lot, and I like to be pretty serious. But I just want you to know that if down the road we were ever to have kids, if we had girls, they would be carriers. If we had boys, they'd be fine. They'd both be fine. But the girls would be carriers. So one day, when they have kids, they would have Barth.
So what does it mean to be a carrier?
Well, what it means is they can have Barth kids like me. They would have a lot of the features like me and probably need a lot of the treatments like me, but they also could have healthy boys. I mean, they're not 100% going to be have Barth, but I just want to let you know that could happen.
Thanks for telling me. You can talk to me about anything. I think maybe it would be helpful to talk to someone who knows more about the science or stuff. That might help for both of us to understand and know what we're getting into here.
Yeah, that might work. I would like that.
Good.
Yeah, let's grab a break.
Good. Does anybody have any comments or about the that twosome scenario there? Specific comments they want to throw in? Realistic, Aldo? Wait for the mic. Come on, Ned.
Just enjoying the show.
Yeah, just with the age of some of the guys, obviously these scenarios are going to be closer than we thought. Some might have already happened, that. But I just hope mine goes less awkward, Mom.
I actually thought that went pretty well. She was very understanding.
When Ian is going out with a girl, I give him X amount of time, and if he hasn't told her or any of his friends that he has Barth, I have the conversation with her, whether he likes it or not.
And he knows that he has the timeline?
And he knows that because I know the things he does that I prefer he does not do, and therefore I prefer that the girl be informed of what could be ahead for her and for her children. And I think you have to look, too, as a parent, at, do you know for sure that your son is sexually active or he's not sexually active? Because I think if you know that they're sexually active, you need to inform that girl if he's not willing to. But then I'm also a bossy mom.
Yeah, it's definitely a difficult situation and a difficult call. You want to definitely foster their independence and and not sort of step on the toes of their relationship, but you balance that with, I guess, a concern for, making sure that she's not uninformed and not a part of the decisions as well. So it is a really tough call. We got back in the back, Ned.
Liz said I can't speak on her behalf, so I won't. Yes, honey. The situation that we're talking about now actually has happened in our family. Excuse me, Kelsey, our oldest, who's 25 today, has been dating a few different guys, but she's been with this one guy for about 3 or 4 years now, and it's possible that maybe she might be getting a ring soon or not. But the only thing I want to add was everyone that knows our family knows that Jack is all about Barth syndrome, and anybody that has dated a daughter is inside the home and knows all about it. It's almost as if that conversation didn't have to happen so intently. You pick up casual information, what's Barth, what's the bracelet, what's different things. So I think almost by assimilation, almost by accident, you find out more and more and more about it. It didn't have to come to like a very serious, this is what is, what isn't. As you know, Rebecca, Olivia wanted to be tested when she was 12, and she still does, now she's 17 and a half. Kelsey was tested and she's not a carrier. We don't know if Olivia's gonna be or not, so that's the other situation. But as far as my son is concerned, I don't know that he would actually have to have such a serious conversation with the young lady, because if you're in our household and around our family, everyone knows about Barth and you know just about all there is to know. There's no secrets.
And I think that's probably the case for many families, but maybe not all. I think that sometimes when we have teens, for some boys and young ladies, they don't bring them home that much. They try to keep things private and separate, and so I think it could be very variable between family. And I think it's amazing if you have that relationship where they're in the home and they're very comfortable bringing the boyfriend or girlfriend into the house. And that is a much more natural way of learning and sort of embracing what Barth syndrome is. But I do think there are families where they don't have that benefit. So yeah, we set it up to be a little more dramatic, obviously.
So in our case, so my oldest daughter, she knows that she's a carrier. I mean, she's 33 now. She has 3 kids. I just got to tell you, when they were younger and didn't know if they were carriers or not, great for, just remember you could be a carrier. Don't go out and do anything stupid. But now it's hard because now I've got a 10-year-old granddaughter, so now it's a totally different scenario because we haven't told her, we haven't hid anything about it, but we also haven't explained it to her or even told her that the possibility could be there that she could be a carrier. So I'm just, I wrote down all these notes and not about how to tell her, but I'm just really scared about how it's going to go.
And I think that is, will be, you can't really predict how it's going to go. You really can't. I think you can, come and hear these talks, but I think every mom or parent in this room was probably scared about how those early conversations and things were going to go. And that's why I think we've been trying to sort of bring this side of things kind of a little more out and open and share so that you can learn from each other and support each other through some of these difficult conversations. So we have one more. And this one's a toughie too. So in this situation, we have a 22-year-old sister who just got back her positive carrier results, and her brother, who is a young adult, 18, 19, I didn't put an age. So the sister, she just got her carrier results, and she's positive. She's recently married, so that's why I made her about 22, 23, young marriage, but recently married and really anxious to start a family. But you and your husband have kind of had some conversations and decided to use pre-implantation genetic diagnosis to avoid having a Barth son. And in this scenario, we're going to ask Lee to talk to her brother about that decision to do that. And for her brother, until today, you really had no idea that she would consider PGD, and that you're really conflicted, I guess, about her choice. You know how challenging Barth can be, you yourself, but it still hurts a little bit to think about that she would go to such lengths to avoid having a son with Barth.
So, as you know, Jacob and I have been talking about trying to have a baby. So I just got tested to see if I have the Barth gene, and it turns out that I do. I am a carrier. So we're talking and we're thinking that maybe we want to try it's called the PGD. That's where you would use in vitro, and then you could only have babies that don't have the Barth gene. And we talked about it a lot, and I was just thinking there's so many hard things that my kid was going to have to face. And I thought if I could take away just one of those, it would be easier. And I'd love to have a kid like you. I'd love to have a kid who's as smart and funny and awesome as you are. And there are so many great things about you that are separate from Barth syndrome. And I think if we take that away, you're still this awesome kid. And I just want you to understand that there's nothing wrong with you. And you're great. And how are you feeling?
Well, I can't say I'm, real happy with the idea, but I understand. I mean, clearly, my life has not been easy. I've had my ups, my downs. But let me tell you, I mean, if you don't get this, you're gonna have one hell of a kid. I mean, he'll grow up with someone to talk to about it. He's gonna meet some of the greatest people in the world. I'm lucky because have I not had Barth, I would have never met any of these people. And, yeah, it kind of sucks sometimes, but, if it's meant to be, it's meant to be. But I do understand that, life would be probably a little bit easier for him without it. So,
Okay. Well, we're still talking about it. I'm not pregnant yet, obviously. But I think either way, my kid's going to be lucky that they have an uncle as great as you.
Thank you. Well, whatever you and Jacob decide, I'll support. So, just want to let you know I have your back no matter what.
Oh, good. So that last one is a really tough one, and I know it is a tough one, but I think it's something that we don't always think about or talk about, and we haven't really talked about yet, so that's why we put it in there. And Lee and Jack, I know that wasn't easy, but so thank you. And I don't know, does anybody have any comments on that one, or I should have put that one earlier in the mix, maybe. Okay, so I think that this was a really good dialogue, I hope, and sort of just to help start giving some examples and some just sort of ways to, tips and strategies, right, was the title we came up with, to kind of start to think about some ways you can talk with your boys and daughters. Genetics is not just explaining the DNA. As they get older, it gets into a lot of these more difficult conversations as your kids grow up and turn into young adults, and we have a lot of those in our community right now. So really wanted to make sure that we're starting to think about sort of some of these tougher conversations as we get older. So thank you guys, and I just, I'm so grateful to the Barth families for entrusting me with your kids over the years. I've learned so much from all of you guys. And just for the continued support of the Barth Foundation. So thank you.